All right, sit right behind the table.
Okay.
Good. Gonna take a look at that knee.
Perfect.
I'm a physical therapist. I work on my feet all day. Some days are longer days, 10 or 12 hours, and I'm on my feet. 10 years ago or so, I ran a marathon, and after that, I had hip pain. My kids were still young, and I couldn't run after them. I couldn't even ride a merry-go-round horse. I saw Dr. Schiller initially in the practice, and he did a scope, and he told me I'd need a hip replacement. After the scope, it was good for a little while, then it progressively got worse. I really had limited mobility in my hips, so I couldn't get around the table quickly. I couldn't get up and down from the floor quickly. I couldn't demo exercises. And at night was when I had my most discomfort at the end of the day, living on anti-inflammatories. And even though I tried conservative measures with some standard physical therapy practices, it was time. See you again. Having been a therapist in Rhode Island for over 35 years, I knew everybody and I had vetted different doctors. I met with Dr. Jenkins and he and I just hit it off. I liked his detail-oriented surgery and his professionalism.
Mario is somebody that I've known for years. He had cared for many of my patients and saw the work that I did and the care that I took in the direct anterior approach of hip replacements. And this is somebody who saw many patients from many providers in our state and surrounding states. And the fact that he chose to come to me for his care really meant a lot.
He did my first surgery about 5 years ago. My right hip, I had it done at Miriam and had a wonderful outcome. I was significantly better. I could ride my bike, kind of jog a little bit after the kids, and I was much more active till the left hip started acting up. Function went down. I couldn't do those same things, couldn't get on and off my bike, couldn't go to the gym. My son now was active in sports, couldn't coach. My second hip was done 9 months ago at Kettle Point.
With his initial surgery, we didn't have as many options as we do now. Now we're performing many of these types of hip replacements at our East Bay Surgery Center. And when Mario came back for his second hip, talked about the benefits of surgery in the hospital, which he had a great experience with his first hip, or having surgery in the surgery center. And he opted for the surgery center.
And I had an exceptional outcome there. The staff was fantastic from start to finish. I have nothing but praise to say. The physical therapist came in and I walked and did all the things they could do. I left Kettle Point in a nice car that took me home, and the CNA walked me into my house, and I was great. I was back to work relatively quickly with no limitations. I didn't feel any discomfort. I felt like a new man.
The patient that is a good candidate for outpatient surgery, I think, will do a lot better being in their own home environment. And there's a certain degree of healing that I believe happens when you're able to recover in your home. Mario had both of those two experiences. He had experience of one hip in the hospital and one hip in the surgery center, and he can really speak to what the differences are between the two.
9 months, I feel great. I'm in my late 50s. I feel back to where I was in my 40s. It made my job so much easier. I could now demonstrate activities. I could be on my feet. Patients are amazed at my mobility, getting up and down from the floor, doing everything in PT. I can go back to coaching. A lot of times in physical therapy, we encourage patients to avoid some of the bigger surgeries. But in this case, with the way Dr. Jenkins does his hip surgery, his attention to detail, it was really life-changing.
When you have a patient come back like Mario who can really push the limits of what the expectations are and the function of hip replacements, it really makes it worthwhile to stay doing this job.
If it is truly an arthritic hip, it is a life-changing surgery. It's still a surgery, but at Kettle Point, they mitigate as many risks as they can. They were very professional. It was an outstanding team effort there. I had an amazing outcome. So I would tell people, if they're hesitant, don't wait until you can't have it done. Get it done while you can still be active and you can help your lifestyle improve.